Welcome to Joy in Our Town. I'm Lisa Boldo, and our issue today is health. And we're learning about the benefits of thermography here in the New York City area. We're joined by certified clinical thermographer Tammy Kohlschmidt. Tammy, thanks for being with us today.
Thank you, Lisa.
So, Tammy, what is thermography?
Thermography is a functional test that can detect early disease symptoms, maybe even before you feel them. It's done with a digital infrared camera, so it's actually measuring your body's temperature. And this is important because your body's temperature needs to be even and symmetrical on both sides. So if you have one side of your body part off, versus the other, then we know that something is brewing. Usually it's inflammation.
Wow, interesting. So what does thermography look like?
Well, the image itself, it can look differently depending on which span or color scheme you choose. I work in a rainbow color scheme, so you'll see all different colors from blacks to purples to whites to blues, and they all range varying depending on what body part we are actually imaging.
Does it mean, for example, because you said all these different colors, do they each mean something different?
Well, they show the range of temperature from hot to cold.
Oh.
White is the hottest and black is the coolest.
Oh.
So you can have a variety, and nothing is bad or good. It just depends on your body and what is symmetrical for you.
And when you say symmetrical, what does that mean?
Well, if we're talking about, let's say, the breasts, if we have one area on the breast that is red and the opposite side is green, green is cooler, red is hotter, so we want to pay attention to that hot spot.
That's good. So what can thermography detect?
Thermography can detect many things. Inflammation is one of the most important things because that is the start of early disease. But we look at neuropathy, we look at digestive stagnation, lymphatic stagnation, tumors, obviously, and any kind of acute pain or even chronic pain.
But how would it detect if you had, per se, like a tumor? Would it just be a spot that, heats up or that shows hot, and then when you say you have to pay more attention to it, like, how do you do that?
Well, again, so thermography is a functional tool.
Okay.
Its job is to look and see how your body is functioning. If the area with the tumor has red around it, because tumors are usually cool, like there will be a cool center and then there will be red around it, that's the laying down of blood vessels. It's called angiogenesis. So we know that the function in the body at that point is progressive. The tumor is progressing. It's actually feeding off of the blood supply.
And you can tell that pretty much just from the imaging.
Yes, and sometimes it's not exactly easy to detect. You have to look at it in different ways, get measurements. So
there's a little more to it.
There's more to it.
That's awesome.
Yeah,
so why is it so important to detect inflammation in the body?
Well, inflammation is a big problem because you don't even know you have it. You don't even feel inflammation. It can be brewing and smoldering for a long time. And it is the start of diabetes, heart disease, Alzheimer's, cancer, all of these chronic diseases that we're faced with. Inflammation is the start. So if you can find it in your body, catch it early, start to do things that takes you from this path to this path, you can eliminate disease.
And combat that inflammation.
Completely.
Wow. Very,
Get yourself healthy.
So what parts of the body does thermography detect, or what for disease?
Okay, so I do full body scans from head to toe. The only thing we don't look at is the brain because it doesn't read through the hair on the head. So anything goes.
So from this, pretty much like from the neck down?
Top of the head, so all of the face.
Oh.
Right, we're looking at the sinuses, we're looking at the carotid artery, the jugular vein, the oral cavity, gum disease, all that.
Wow, you can even detect gum disease. That's pretty interesting. So what can a person expect during a visit?
Well, I can tell you that if you can imagine going in for a breast screening and not having any pain, having no body contact and no radiation, that's what you can expect, a pain-free, easy, non-invasive visit.
Wow.
You will be in a room cooling for about 10 minutes. So I would say that's the worst part is it's chilly.
It's chilly.
Yeah, it's chilly. But that's it. It's easy, and it's fun, and it's interesting because it's all about you.
How long does the test in general take?
I usually say the appointment is a half an hour, depending on which screening you get. It can be anywhere from 5 minutes to 20 minutes.
That's not bad at all. So is thermography used just for women, or can it be used for men? Can it be used for children? I mean,
All people.
Really?
Yeah, I do children. You know, it's interesting, men and women, we all have inflammation. So I get a lot of women coming in for the breast, but the men need to consider that we can detect prostate inflammation.
Really?
We do testicular screenings, which huge, very important to know if you have inflammation or not.
absolutely.
Because you don't feel it.
Wow. So how is thermography different from mammography?
So mammograms are anatomical. All they are, anatomical meaning they are just taking an x-ray of a body part. That's it. You get no information about your health. You get no information about where you're going with your health or how to handle disease. With thermography, it's functional. So you can look and see, okay, I have these issues. What am I going to do to go this way? So you can make choices and be very proactive.
And do you help people to make those choices?
Yes, that's my favorite part.
Oh, that's wonderful. So do you find that thermography is getting more popular among people, and women in particular, today?
I do. I think because people are tired of the disease model of medicine. They're tired of just dealing with the disease and not being proactive and seeing what's really going on inside and how can we change that. And that's what thermography does.
So are there steps that a person can take to improve their visit, you know, after a thermography session?
You mean improve like their next visit?
No,
Or what do you mean
or
by improve their visit?
Improve their, or, you know, improve the results, I guess I would say,
oh.
of their,
Yes.
the results of the session.
That's right.
Whatever
Oh,
you find.
So after you have your first session and you get your images back, you get a report by Dr. Melvin, who reads for me. He will make recommendations that will take you from this path of disease to the path of health. So you do get coaching, you get guidance, you get a really good idea of what's going on and
So
how to change.
It's really a full scale, I mean, it can, whatever you choose.
Yes.
Yeah, and I would assume that the cost is probably a lot less than a traditional mammography visit.
I think when you take a look at the cost, the value and the information that you're getting about your health, you can't even compare it. It's uncomparable.
Wow.
Because a mammogram's just a picture.
It's just a picture.
That's it.
Would you say that thermography or a thermogram provides a lot more peace of mind to the individual?
I think so. It puts control back into the patient, and it gives them an understanding of what's going on in their body, and then there's all of these things that they can do to make those changes.
Yeah, and then how long between visits do you recommend for thermography?
Well, you know, it's interesting. You have to get a baseline. So let's say you have visit 1.
Okay.
Depending on what Dr. Melvin sees, you will either be back in 3 months or 6 months to complete your baseline. I have women who currently have cancer, and they come in and they track their disease. So they'll do images once a month just to see what's going on with the tumor. Is it growing? Is it getting better? Is their digestion stagnated? Do they have lymphatic congestion? All kinds of things are answered for
And
that.
you can tell that from the thermography.
Yeah.
That's amazing to me.
So
Wow.
it's fun. It's tracking, and you see people grow and change.
So if you see a hot spot and Dr. Melvin gives a recommendation, does he tell you, well, it looks like it could be this, maybe you better go to your doctor now and get checked? Is that how it works?
Yes, yeah, he makes recommendations in that way also.
And then when they come back for a follow-up visit, they'll have another, I guess, session again. You'll see what's happening. And then, but you guys recommend, you said, coaching or nutritional guidelines?
Oh,
or, right?
absolutely.
Do you do that stuff?
Yeah, there's
It's amazing.
there's cleanses that can be done.
Wow.
There's body work. There's different types of exercises.
You mean like massage or
yeah,
skin brushing?
Skin brushing, even acupuncture. It just depends on what the issue is.
Wow, that's pretty neat. So how did you become so passionate in this area?
I have a long history of health problems,
Really?
like from birth. So my whole life has been on a quest to figure out how to heal and then how to stay healthy. So everything that I do in my life is based on self-care, and that's what I try to bring to my clients.
Yeah.
How to take care of yourself.
And it shows you really have a passion for helping people,
Yeah, I do.
right?
Yeah.
So, yeah. So what would you say to our viewers as far as if maybe someone's thinking about, should I get a mammogram? Should I get a thermogram? What would you say to
I
our
would
viewers?
say to try thermography and just get a look inside of your body to see what it is that you may not feel. Because dysfunction is something that you don't feel until it becomes a sign or a symptom. Once you have a sign or a symptom, you're headed down the road towards disease.
And does that mean, if there's a sign or a symptom, does that mean that it's probably been there for a little while and maybe
It's possible.
now there's a problem?
Yeah.
So we have to address that.
Yes.
Yeah.
Yeah. That's your body's way of telling you, look, something's wrong, please deal with this.
Or if there's pain in the body, do you
Yeah.
think it's a good idea to
Absolutely.
get a thermography?
Absolutely. Gallstones, we detect those quite often.
Really? Wow.
Kidney disorders, carotid artery or cardiovascular distress. We've seen quite a different variety of things. It's not just breasts.
Yeah, I guess, you think mammography,
Yeah.
thermography, but it actually, tell us again, what are the areas that thermography covers again?
So we go from the face, which is the top of the head, all the way to the feet. So we can do full body.
And do you do it in sections at a time?
We do because we like to focus in on certain body parts. So there will be images focused in the pelvic region, the abdominal region, the legs, that kind of thing.
Okay, and if you're detecting that someone has an issue, and Dr. Melvin will go over the results with them, is it like a real detailed report?
It is.
How does that?
It's a very detailed report. So what I do is I spend time with the client reviewing it, answering all of their questions, just getting them on the right track. And then I have ongoing email support as well.
Do you really?
Yeah.
Now, is that for a certain amount of time, or it's just as they have a question?
Yeah,
Sure, you probably get a lot of referrals, too.
Yes, and I send them videos so that they can refer back to their videos that match their recommendations.
That's fantastic. Do you offer, complimentary consultations, or?
Not really complimentary consultations. I will do headshots so that they can come in and see what it's like. And from that headshot screening, we can detect other things in the body.
Well, this has been absolutely amazing. Stay tuned. You're watching Joy in Our Town, and we'll be right back to continue our conversation with Tammy Cole-Schmidt after these messages.
Thank you.
Yeah.
Look, here's a charge for something we didn't order.
Good catch.
I don't think you should ever pay for any bill unless you have first made sure that all the charges are correct.
Speaking of which, have you heard of the latest Medicare scams? This happened to my friend. A man came to her door claiming he was from Medicare. He had a smooth line about helping seniors with the high cost of their medicines, but she had to give him her Medicare number right then before the deadline. Well, when she got her Medicare summary notice, it was full of charges for services she hadn't received. Turns out this guy was a scam artist.
Medicare already has everyone's number. They wouldn't need to ask for it.
Scams like these hurt every taxpayer, draining billions from Medicare and making it harder for people like us to get the health benefits we're entitled to. So I did something about it. I joined the Senior Medicare Patrol, where I work with other volunteers to teach my neighbors how to protect their Medicare numbers, review statements to spot false charges and detect errors, and report suspected fraud.
Mom was diagnosed with Alzheimer's at 58 years old.
8 years into the disease was when all the light went out.
For me, it was heart-wrenching.
Looking into the eyes of somebody with Alzheimer's, sometimes you just don't see the person's soul is like gone.
And it takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
She actually thought those of us who were caring for her and who loved her most were her worst enemies.
More and more responsibilities fell on my shoulders.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable. My mother taught me to be in the moment.
We have to live in the moment with them.
And I'm going to be with that person right now in this moment, wherever she is.
Now is the moment. If we work together, we can stop this epidemic.
Contact Bright Focus and learn more.
Welcome back to Joy in Our Town. My name is Lisa Boldo, and our issue is health. But in this segment, we're going to focus on dental hygiene. We're continuing our conversation with certified clinical thermographer Tammy Cole-Schmidt. Tammy, thanks again for being with us.
Thank you.
So Tammy, you are not only a thermographer, but you're also a periotherapist.
Yes.
So is there a relationship between what you find using thermography and dental hygiene?
Yes, and one of the reasons we brought thermography into the dental clinic was to track inflammation, because as you know, inflammation is a major problem and cause for disease, and it's disease throughout the whole body, whether it's heart disease, diabetes, or gum disease. So when I would examine the mouth, what's interesting is you don't always see inflammation. It's smoldering, it's burning, it's low. So by doing thermography, I could pick it up in areas that I didn't clinically see with my eyes.
You mean when you're doing a face?
Yeah, and we also do something called an oral microscope test. We test for oral parasites and active bacteria. So I would be able to, you know, look at the thermogram and see where the inflammation was in the mouth, and then test the saliva and kind of marry the two, you know, findings.
Wow.
Because most people, if they have the infection in the saliva, they have no idea. They don't feel it, it doesn't hurt. Meanwhile, that infection is traveling through their bloodstream, raising havoc in all different organs and body parts.
Wow.
So it was really a cool thing to bring together. And then, of course, they both evolved separately on their own into two different things that I do.
Very interesting. You know, we don't typically consider dental hygiene to be a serious health concern. We're always looking at the externals and other different things.
Yeah.
But talk to us about why dental hygiene is now moving to the forefront of medical and dental care.
So this is exciting. There's a whole movement right now called Bridging the Gap between dentistry and medicine. And what we're finding is that doctors are striving to heal their patients from all these systemic diseases, and they can't because they're missing something. In other words, they may get some good results, but then the patient will fall back, or there's just something not quite right in the healing process. And it has to do with hidden inflammation that they're not finding, which is usually the mouth. Again, you can have inflammation in the mouth and never feel it and never know it exists. So the things that we're doing in the mouth, once you can get your mouth cleaned up, you drop your inflammatory markers in your body and you get rid of the infection that's traveling through your bloodstream from your mouth.
So is it sometimes not enough to just clean your mouth?
You mean as a patient at home?
Right.
Well, exactly. It's a start, but you will never know if you have this infection unless you have your saliva tested. There's no way to know. Unless you have obviously issues of bleeding gums, then that's something different.
Could that be a sign?
It's a sign.
Wow.
Yeah, it's a sign.
So what's the correlation between poor dental hygiene and oral systemic disease?
Okay, so poor dental hygiene can mean a few things.
Okay.
If someone tells me I brush my teeth twice a day, and that's all they do, to me that is poor dental hygiene. Because you have to think of your mouth as teeth and gums. So if you're only brushing your teeth and you're not taking care of your gums, you're missing a huge inflammatory issue. So you have to take care of both. Then if you're not getting regular hygiene visits, you're not getting under the gum line cleaned, which is where all of the pathogens hide and nest.
When you say a regular hygiene visit, what does that mean? Getting your teeth cleaned every 6 months, or what does that mean?
Well, again, it depends on what the hygienist finds. Now, most hygienists don't do the depth of work that a periotherapist does.
I see.
So they may just be getting their teeth cleaned and not actually getting gum work.
So what's the difference then between a dental hygienist and a periotherapist?
Okay, so a periotherapist does salivary diagnostics. We test for HPV. We look for oral parasites. We look for active bacterial pathogens. We look at their genetics. We need to know if they're genetically predisposed to gum disease or not. We can test for the pathogens that are in the root canals. all of this matters because all of those pathogens are traveling through your bloodstream. The connection with oral systemic disease, it's proven, there's literature out there for miles, that there is a correlation between spirochetes, which are found in the mouth.
What is that? Parasite?
It's a active bacteria, highly pathogenic bacteria. And it's been linked to Alzheimer's. They're found in the brain.
Really?
So the question is, well, how did it get there? Well, usually there's a pathway through the bloodstream from the gums.
Really?
So now we're also looking at heart disease, diabetes, preterm births, arthritis, pretty much anything, cancer, anything that has an inflammatory response, you have to go back and look in the mouth. You have to.
So let me ask you, because you talked about you might just be taking care of your teeth, but maybe not necessarily your gums. How does somebody take care of their gums at home?
Well, that's an interesting question because you can take care of your gums at home with an oral irrigator.
Okay.
It's a device that has a little squirt gun that you shower around your gum tissue and you clean it out. That will get rid of the free-floating bacteria. It will not get rid of the nests. There's something called a biofilm, and these bacteria build this protective layer around them. It's a nest that they live in.
Really?
And so when they leave the nest, you can free them, you can get rid of them with the water, but it takes lasers and it takes deep cleanings to actually break up the nest.
Interesting.
Which brings me back to being a periotherapist. We do laser therapy. That's one of the most effective ways to break up the biofilm.
And then how often does that have to be done, or does it just depend on?
It depends on the severity of the issue.
Okay.
It depends on the type of pathogens. It depends on their genetics, their predisposition for inflammatory disease. And it depends on their clinical signs and symptoms. I sometimes see patients for 6 months, every 2 weeks, then every 6 weeks. I mean, it can be intense.
Depending on how severe the situation
Yeah.
is. That's amazing. So is there a gap between dentistry and general medicine?
I believe so, and that's what we're trying to fill. Again, as a periotherapist, we do look at the patient's blood work.
Yeah.
So regular hygienists really don't take that into account as much. So that starts to bridge the gap.
You said you look at their blood work?
Yeah, we want to know what their CRP markers are. We want to know what their plaque 2 score is. We want to know their D3 levels.
And do you take those tests?
No, that's again, we stay in contact with the patient's doctor.
Excellent.
Yeah, so that we can talk about the case. If they're trying to heal from heart disease and they have a mouth that is unhealthy, they're not going to heal.
Wow.
They're going to be at a higher risk for the next cardiac event. So.
Wow. How important is nutrition to oral health?
Nutrition is huge, and if I can lump some things together with nutrition, we also have to look at their pH, because if their tissues are acidic, once again, the healing's going to be compromised. I need to know if they're exercising. I need to know how they're sleeping.
Yeah.
I'm also interested in if they breathe through their mouth or not. If they breathe through their mouth, they're going to have another hidden form of inflammation.
Wow.
Because mouth breathing lowers your CO2 levels. Imagine a can of soda. You pop it open and it's fizzy and it's got a lot of life. As the CO2 levels go down, the soda becomes flat and lifeless. That's what's happening in your body when you breathe through your mouth. Wow. You deplete your CO2 levels. And then that causes inflammation. But it also causes your tubes, which is your digestion and your arteries and all the lymphatic, to become really tense. So now you're looking at hypertension and stagnation throughout the whole body.
Just from breathing through your mouth?
Just from breathing through your mouth.
Oh,
so nutrition is a big part of it. Obviously, you have to do things to take care of your bones. I would say vitamin D3 is one of the top supplements.
Sure.
Vitamin K2 is another top supplement to keep the bone and the teeth healthy. Vitamin C for the actual tissues, the capillaries. It's a big deal.
So nutrition is a big deal.
Yeah.
So do you have some tips that you can give us to keep the mouth healthy?
Yeah, so let's go back to irrigation, which I talked about.
That's the spray.
Yeah, that's the little squirt gun.
Okay.
So if you are just flossing, you're doing good at removing food, but you're not going to remove infection. You're not going to remove the bugs because floss only can go around the neck of the tooth, and a pocket in the gum goes much deeper. So you're missing it.
So it's more important to do the irrigation.
Yeah, because the water can float under the gum line and clear out the bugs. And food. It does both.
Okay.
So a healthy tip would be throw away your floss and get an irrigator.
Really? You don't need to do both. You can do one or the other?
Exactly. I wholeheartedly believe in water picking or hydroflossing.
And anyone can do it? Do you teach people how to do it just like you would teach someone to floss?
I do. I teach them how to do it. And it depends on when to do it, depending on their mouth. And, you know, floss is great after lunch if you can't brush and you have food caught.
Yeah.
Definitely. But it's not for disease.
Right.
It can't heal.
So floss is kind of a surface thing, but...
It is, yeah.
Okay. So you talked about the importance of nutrition, and you talked about the importance of exercise, and for what? To reduce the inflammation?
Well, exercise reduces your cancer risk by 50%.
Wow.
And it's because you're oxygenating. Oxygen kills cancer. Oxygen also raises your pH. So again, if you're an acidic person, oxygen will come in and help to balance that.
So if you've got acidic tissues, that's going to deplete your oxygen as
Well,
well? Or?
Acidic tissue causes inflammation, and it harbors bacteria because bacteria thrive in acid.
Oh, and that's good. And then in your mouth, if you're doing mouth breathing, do you feel like more bacteria can get in there as well?
Oh, yeah, it's a breeding ground. Yeah, it's more tooth decay for sure.
For breathing through your mouth. And when you breathe through your nose, I know I've heard it said that the filters keep the...
Yes, exactly. It filters the
air.
the bacteria, the viruses. It moisturizes the air so that when it gets to the lungs, but it also creates a nitric oxide response. So it's good for the heart.
What about that thing I've heard of with oil pulling? Do you think that's a good idea?
I do. I love oil pulling. You can do oil pulling. You should do it, excuse me, first thing in the morning on an empty stomach.
So how do we do that?
So you take like a tablespoon or 2 tablespoons of coconut oil, put it in your mouth, and you just swish. Like, you just keep swishing. But you have to do it for like 10 to 20 minutes.
Okay.
So you can do it while you're in the shower.
And then spit?
And then spit.
And if you can't hold it and you just do it, you're okay, right? You're gonna still get some benefits,
yeah,
right?
Spit it into the trash, not into your sink, so you don't clog up the sink.
Or into the toilet.
Yeah, don't do that.
So,
but oil pulling's great. It pulls toxins out, especially chemical type toxins.
Excellent.
Yeah.
Tammy, thank you so much for being with us. And thank you for watching Joy in Our Town. We'll see you next time.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.